Nairobi. But then, and just to cross over live to at a Nairobi hotel where Amref Health Africa in Kenya today is launching its strategic plan for the year 2023-2030. Accessible and affordable healthcare are among the issues given the top priority in a bid to improve primary healthcare facilities across Kenya. If the goals are to be implemented, Kenya health sector is bound to improve. So we cross over live and listen in.
With its objectives to drive lasting change. Let us remember that the challenges we face are formidable, but our resolve is unwavering. With Amref's strategic plan as our guide, together with the other plans that we have, we can navigate these challenges with determination, innovation, and solidarity. By working together, we can realize a future where every Kenyan enjoys the highest attainable standard of health, that is our constitution, and a future where health is not just a privilege, but a fundamental human right. Thank you, Amref Kenya, for your dedication and inspiration. Thank you, our partners, both local and global, for your unwavering support. Let us unite our efforts driven by this plan to create a healthier, happier Kenya for generations to come. As we embark on this journey, let us remember that the path to progress is rarely easy, but it is always worth it. Together we can transform healthcare, uplift communities, and leave a legacy and a better health and well-being. Asanteni sana, and congratulations again to Amref. And to give our full commitment as the Council of Governors, representing my chair here, Dr. Ann Waiguru, and the entire team, to give you our commitment that we will work together. You'll never walk alone. Asante sana.
I think the women are taking over the podium here. I think we are now ready for the keynote speech, and it's again my honor and my pleasure to introduce the Principal Secretary, Mary Muthoni, from the State Department for Public Health and Professional Standard, who will give the keynote speech on behalf of the Cabinet Secretary for Health. Welcome, Mary Muthoni.
The governors present today, the Amref fraternity, led by my good friend, Gigi. Ladies and gentlemen, good morning. I think it's still morning. You know, when you're sent, you have to adhere to the rules. So I want to give apologies from my Cabinet Secretary, who got some other duties to attend this morning, and I had to be the one to come. So we have to contend with that for now. So ladies and gentlemen, I would wish to deliver the message from the Cabinet Secretary. She really wanted to be here because Amref Kenya, Amref Africa have been our friends. They are the friends of Kenyans. And especially when you see a quote like this, transforming communities through primary health care. For those who understand what primary health care is, really, it is where we are going to. And as a ministry, I want to reiterate that we are moving from curative to preventive. When I listened to Gitahi's speech, and he kept on talking about it, but in a different language, all the same. But we are talking about the same thing, that we are moving from curative to preventive. Therefore, allow me to read the speech, and in between, maybe I will intervene with my own words. Distinguished guests, ladies and gentlemen, it is an honor to join and address you on this occasion of the launch of the Amref Health Africa in Kenya Strategic Plan 2023 2030. This occasion marks a significant milestone in our collective efforts to advance the health in our nation. First and foremost, I would like to express my most profound appreciation to Amref Health Africa for your dedication and unwavering commitment to improving health outcomes across Kenya and Africa at large. Since its founding in 1957, Amref has been at the forefront to quality healthcare services for all Kenyans. This new strategic plan reflects your continued passion and determination to make a lasting impact. The strategic plan, which envisions transforming the health of communities through primary health care with a focus on women and young people, will contribute to propelling our country's social and economic development towards the aspiration of the country's Vision 2030. I am delighted to see how Amref Health Africa aligns its efforts with the government's Manifesto of Universal Healthcare Coverage. As I have read through your strategy, it is clear that your organization is fully supportive of the government of the Kenya bottom-up economic transformation agenda that will give full attention to integrated preventive and promotive health that begins at the household. And this is where we are talking about our community health promoters, that the people at the villages, at the households, they are able to be taken, even the minutest of the ailments that might be there. The community health promoters are able to cater for that. And right now, as we are speaking, we are going through the country's, the largest healthcare assessment of our facilities. And this will also help us to know what level of facilities do we have in level 1, how many do we have in level 2, level 3, and so on and so forth. Therefore, through this, we will set up and operationalize the Afya Bora Mashinani UHC model founded on a primary healthcare approach with a strong community health system. To make the model deliver results, the government has prioritized 4 pillars that the Ministry of Health has prioritized, namely, 1, the commodity security, and in this, the government is committed to ensuring the availability of quality health products and technologies at all levels of the health system. We will focus on strengthening local manufacturing of essential commodities based on the essential package of services. And the second one, very critical and important, is on the human resources for health. And I've just said that we are leveraging on the 100,000 community health promoters supported by community health assistants to drive the preventive and promotive healthcare agenda. Your Excellency, Governor Wanga, she has said what the counties are doing. And I want to report that we are working very closely, Madam Vice Chair, and she can confirm that in support of the community health promoters. The government is going to pay part of the package, and the county, the national government will pay part, and the county government will pay the rest of it, just to ensure there is impact and there is sustainability of the same. Again, we also have the integrated health information technology, and through developing the digital health ecosystem that allows interoperability and provides data for action. We will start with the electronic community health information system and ultimately hope to achieve patient data portability. There's one thing to go to a health clinic, and there's another that if you mean to change that health facility, your data can be seen from the other side. And that is what we are really trying to see at the primary health care facilities. The government, again, through health financing, is implementing the paradigm shift in health financing, including support for a benefits package that is fully responsive of the needs of the people of Kenya and social health insurance. Ladies and gentlemen, the Ministry of Health appreciates Amref Health Africa's support in providing results-focused technical assistance in the 4 pillars of UHC that the ministry has prioritized. We will soon sign a cooperation agreement between the ministry and Amref, defining key areas and desired results for technical assistance. Ladies and gentlemen, there can never be an effective and efficient healthcare delivery system without the participation of the people themselves. Gracefully, Amref's strategic plan is anchored on 2 pillars: people-centered health systems addressing social determinants of health, which are aligned with bolstering the government's manifesto on health. The first pillar, which is the people-centered health systems, emphasizes placing individuals, families, and communities at the heart of healthcare. The aim is to empower communities with knowledge and skills to enable them to take control of their health. Amref Health Africa recognizes that a truly effective and sustainable health system must be designed around the needs, preferences, and aspirations of the people it serves. By adopting a people-centered approach, Amref Health Africa ensures that healthcare services are accessible, equitable, and responsive to the diverse needs of our population, integrating health promotion and education in all health services at all levels of healthcare service delivery. By deploying people-centered health systems, Kenya can deliver on the big bet of transforming Kenya's population health by 2030, to be evidenced by drastically lowering maternal and newborn mortality, eliminating infectious diseases such as malaria, TB, HIV, cholera, and measles as public health problems, flattening and beginning to reverse the NCD trajectory. That is diabetes, high blood pressure, mental health, illness, and cancer. Equally, ending neglected tropical diseases such as intestinal worms, bilharzia, and elephantiasis. Ladies and gentlemen, the second pillar, which is addressing the social determinants of health, acknowledges the significant influence that social, economic, and environmental factors have on health outcomes. The ministry knows that besides healthcare services, good health is a function of various social determinants of health. These factors include education, agriculture, housing, water and sanitation, sports, and the environment. It is a delight that this plan provides strategies for collaboration with other sector ministries to reduce the disease burden. Evidently, Amref understands that the health sector needs to partner with multiple stakeholders to make health and well-being for all a reality. Addressing social determinants creates an enabling environment where individuals and communities can thrive. This holistic approach is crucial for achieving equitable health outcomes and reducing health disparities nationwide. Ladies and gentlemen, as you all know, implementing this plan will require much hard work and the collaboration of various stakeholders and line ministries. I therefore appeal to the development partners and all stakeholders working in the health sector, the media and the general public to extend to Amref a hand of partnership to make the implementation of this plan possible. And as I conclude, we would like to thank His Excellency William Samoei Ruto, the President of the Republic of Kenya, for steering the nation to make significant strides in uplifting the standards of living, for being at the forefront of driving the economy, social development blueprint, Kenya's Vision 2030, and focusing on UHC as one of his government's agenda. Congratulations, Amref. The management, the staff, it wouldn't have happened if all of you are not working together. And let us unite and continue collaborating, leveraging on our strengths to ensure that all Kenyans receive the quality health care they deserve. It's the high time as Kenyans, as a people, to move decisions from the table into action. It is the high time that the health sector of this country worked. And we have the right people, everybody, from the county governments to the national government, to our partners who are really very happy to listen to us every other time. Whenever we have a meeting with Amref, there's always something new that we have to discuss, and we move it from the table into action. So together we can transform the healthcare landscape and achieve our shared vision of universal healthcare coverage and create a healthier and prosperous future for our nation, because health is an instrumental pillar for economic development. You know, I am happy to see that a climate crisis is one of the pillars that you have. In health, at the ministry, we are talking about zero-emission health sector in future. We are talking about innovative approaches. What practices can minimize emission? We have to go through that. The collective action that we have to do. And it will take two to tango. It will take the Ministry of Health together with Amref and other partners on board to ensure that we are clearing this. To the Amref family, led by the Group Chief Executive, my good friend, Githinji Gitahi, thank you for your commitment and contribution that has ensured that Amref continues to create a lasting health change in Africa. Lastly, I wish to thank our esteemed partners. I can see many of them in the room.
So right there is the PS for Health, Mary Muthoni, talking during the launch of the Amref strategic plan for the year 2023-2030, saying that as a country we're moving from curative to preventive holistic measures, and we are also going through the largest hospital assessment. That is what the Ministry of Health is currently doing in a bid to provide quality services and to work hand in hand with the community health promoters to deliver health services to all Kenyans across the country. They're also working together with the county governments, and she goes ahead to say that as a Ministry of Health, they are developing digital services in enhancing service delivery, and are going to start with the information department in every health hospital to provide a paradigm shift to improve healthcare services. She was talking on behalf of